Well, wasn't that refreshing? You look incredibly restored, renewed, reinvigorated. You really haven't ever looked better. The only thing I can tell you is with these lights, I can't see much of you. But what I can see, you look great. And so you look even better sitting down because we are thankfully just about to begin our final panel presentation. The National Academies of Sciences, Engineering, and Medicine, which many of you knew previously, Sylvia and others, as the Institute of Medicine, became involved in this issue almost immediately after the Surgeon General's call in 2001. You heard this morning David Satcher, Dr. David Satcher, talk about that announcement. And almost immediately following that announcement, the Institute of Medicine began a process which continues to this day to inquire, to research, to provide the best advice that we could to the nation and the world about all that was going on in the area of obesity. You heard both Jeffrey Copeland and Bill Dietz talk about the establishment of work here that included a standing committee on childhood obesity. It included the Accelerating Progress on Obesity Prevention report. It included a lot of work by a lot of people, many of them in this room. And again, we believe this roundtable is a logical continuation of that effort. Throughout that process, beginning in 2001, a significant portion of that work was sustained by nonprofit and philanthropic efforts, a significant and important portion of which are reflected on this panel here today. So what we've asked this panel to do is talk about the investments that they and their enterprise have made in obesity prevention and treatment during the time period we've been discussing, which is, again, basically this century. Lessons they've learned from the investments that they've made and the implications that flow from that investment and their learnings. Each panelist is going to have a chance to provide some initial remarks, and then presumably there will be time for questions. We do believe the Secretary of Agriculture will be here at 3:30, unless he's not, in which case we'll have an opportunity to hear even more good things from this panel. But because I know them well and because I know how efficient they are, I believe we will complete our work in roughly 30 minutes. There are very long and important biographies of each of these panelists in your materials. I will not go over them again in the interests of their time and their own modesty. I will simply say that Marion Standish is a lawyer, and she never mentions that. She came the furthest for this
Only
presentation.
when it matters. Only when it matters.
Today, and she's at the California Endowment, and I'd ask Marion to begin our conversation this afternoon.
Thank you for that very nice and brief introduction, and thank you all for a great day. I think we have an awful lot to be proud of. I think we have a lot to be optimistic and hopeful about in our work, and it's really exciting as we have these public events and through the work of the Roundtable that we learn so much about the detailed progress that we're making and the multiplicity of activities that are out there in the field. I won't actually say too much about what the California Endowment has done over the last 20 years of its history on obesity prevention, other than to say we have really focused on equity issues, on the environmental challenges that face communities that are significantly burdened by chronic disease and other inequities in trying to address obesity. I thought I would focus actually on the role of social movements in our work on obesity, because it just struck me today that I was missing two things in our presentations and conversation. One is I'm missing a discussion of our values around the work. I think most of us come to this work. I mean, some of us are lawyers and scientists and researchers and social workers, but we're all activists and we're all very passionate about these issues. And I think bringing our values to the table will strengthen our work significantly. And I say that because I was inspired by three things, and I'm going to watch my time because I've really been thinking about this over the last months, that if we were a social movement, would really be catapulting us forward. First, I think we probably all read about the shady history of the sugar industry in the recent release of documents on the Harvard research studies and the role of sugar in our diets. I think we're also really aware of the multiple cities and grassroots movements around the country that are tackling sugar and willing to impose taxes on themselves in order to address some of the issues that relate to sugar consumption, but more importantly, trying to raise revenue in their communities to support prevention and health. So health and the role of prevention really being such a priority that people are willing to exert that lever that so many others don't want to ever talk about. And thirdly, and I think most interesting, has been the power of the water debate around the country, from California to Flint and to most recently Standing Rock, North Dakota. And that if we were a social movement, those three disparate events would really have brought us together around a much larger narrative of our work, how everything that we're doing fits into a much larger work around the food system, agriculture, and it's great that Secretary Vilsack is going to be here, corporate control. I mean, there are many issues that fit into this. And I think as we begin to understand, and our roundtable has been in existence for 3 years, I've been working on obesity prevention for the last 20 years, and I think collectively we probably have maybe 1,000 years here in the room, maybe more. But we really need to start to talk about these underlying systems that impact our work, what our values are as they relate to that work, and how, if we began to see ourselves more as a social movement rather than a set of diverse activities and research projects and interventions, that we would be ever more powerful. But the question is, what is the social movement that we're about? I don't think we can be a social movement around obesity. We could be a social movement around food. And I mean, that's not to say we don't have to talk about physical activity and the role of physical activity, but I think if we actually talk about food, we're talking about the built environment, and we're talking about the environment, because the food movement, as we currently understand it, is a movement of environmentalists, of conservationists, of animal rights people, of many different diverse groupings of people. But health, I think, is the most powerful force within all of those movements. And they have all kind of leaned on health to strengthen themselves. And so I guess in the context of where are we going in the future, I just want to make the argument, and it's just beginning to make this argument, although others have made it before, that we really do need to think about ourselves as a social movement. We need to figure out how we relate and begin to bring together the diversity of this movement, and it could be around food. I think we would venture to say that the food system has failed us in so many, many, many ways. And it's most profoundly failed us globally around our health. Clearly, it's failed us in some ways on the environment and on conservation and on animal rights, all these other groups, but on health, it has been such a profound failure. The food system should be supporting the health and well-being of society, of all our populations, and I don't think it has done that. And I think it challenges us to think about how do we organize ourselves for the future. So let me just make a final point. I think I'm on my final point. Social movements are characterized by a number of things, and I just want to tick them off and let's think about how we fit into that for future discussions, for maybe some questions. One, we do need a vision and a framework for our work, and I think we actually have that. We just need to call it out. We need an authentic base of people at the community, at the grassroots level, who are really engaged with us in meaningful ways. We need to be there for the long haul, and we know this is a long haul challenge. We need to have a vision for government and governance. We need policy packages. We have them. We absolutely have a need for scale. And if today was an example of what we need most deeply, it is a vision for scale. We have so many good ideas. We have so many evidence-based good ideas. And scale is a challenge. And we need to be networked with other movements who are making progress. I mean, the fact that we have 5,000 young people in Standing Rock, North Dakota, fighting over water should wake us up to the power that some of our issues have, and to begin to stand closer with those people and understand that if we're talking about water, we're talking about health, we're talking about obesity. And many of us have linked water and obesity for many years, and clearly that's why we have focused on sugary beverages and water. So I just want to tease everybody with the idea of how do we think about obesity as a part of a much broader social movement, and how do we begin to take the steps to translate our focus on a disease into our focus on a social movement.